Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, and welcome back to the Tongue Tie Experts podcast. I'm Lisa Palladino, and today we are going to be talking about the procedure to release the tongue tie, the lip tie, called frenotomy or frenectomy. There are different ways to describe it. For my purposes, we'll call it frenotomy. It's a shorter word. I like it better. And today we're going to think about how do we make frenotomy, once we know that it's necessary, how do we make it the easiest, the most successful in terms of the results, but beyond the results, I want to talk about how parents or caregivers are going to feel, how the baby is going to experience the day, and optimize it being as simple and giving the least trauma possible. Although frenotomy is a minor, quick procedure, it may be stressful for those who are going through it, and it often is very stressful for those who are going through it. Being prepared always keeps nerves calm and allows for a smoother experience. So today we're going to talk about two aspects of preparation for frenotomy. First, we're going to maybe step back a bit and say, how are we sure that we are selecting a provider that is going to give us the best outcome and a smooth experience? So first we're going to talk about how to select a provider for your child, and then we're going to talk about how to prepare for the day. Okay? So before I get into the topics, I just want to let you know that I will be including written handouts that you can download on these topics, and they'll be in the show notes. But all of this comes from my courses. All of these information are topics that are discussed in both the professional's guide to tongue tie in the breastfeeding infant and the parent's guide to tongue tie. So I have 2 different courses, 2 different paths. One is for professionals, one is for parents. But you can find all of this information about preparing for frenotomy, as well as many other aspects of tongue tie and breastfeeding, in my courses. And the links to those are always in the show notes. So just so you know, in case you don't catch anything, you'll be able to read this, okay? So let's get started on selecting a provider for frenotomy, which is the procedure to release the tongue tie or the lip tie. Now, you're going to hear me use the term TOTS. TOTS means tethered oral tissues. If you're new to this verbiage and this language, and you want to deep dive into what the heck are TOTS, that's actually one of my earliest podcast episodes, is a deep dive into explaining all about what they are. So this is more advanced knowledge that we're talking about today. If you need to go back and get definitions and symptoms, that's all there for you. So again, the term TOTS is tethered oral tissues, which can refer to lip tie, tongue tie, or any other frenum that is causing a restriction of normal movement in the mouth. That's what we're talking about when I say TOTS today. Okay, so before you select a provider, you're at the point where you've had an assessment, you're going through struggles, you've had professional opinions and assessments and diagnoses that tell you that your baby needs or should have a tongue tie procedure, a frenotomy. Maybe you've been told that your baby will benefit from having the procedure, right? I'm not saying that every baby should have the procedure. I'm talking about you've gotten to that place, right? So here we are. Okay, the baby needs a frenotomy. How do I pick the right person, the right professional to do this procedure on my baby, right? So that's where we're at today. So I have a list of questions that I think are very important to ask a provider. And you can ask this over the phone before you even make an appointment with the receptionist who answers, or if you're lucky enough, the provider will have a conversation with you. Or if they tell you, you know what, we answer all these questions in the first appointment, which is a consultation. So you don't have to worry that your questions will be answered when you get here. However, I think that there are a few questions that you want to know even before you get there. Those questions are these. What tool do you use to release TOTS? So what tool? That could be a scissor, it could be a laser, it could be cautery, or it could be scalpel. Now, I did a very extensive discussion of laser with Dr. Peter Vitruk in a previous episode. So you want to go back and listen to that if you want to know more about specific lasers. But you definitely want to know what type of tool the provider is using. There may be people, and there are definitely people, who are very good at using a scissor, laser, or a scalpel. I'm not crazy about cautery in anyone's hands for a baby's TOTS. But a scissor provider may not be, there may not be negatives there, because there are people who do well with that. But it's just information to gather, okay? So after you ask what tool do you use, you want to know, do they treat tongue, lip, and buccal ties if they're present? Now, this is not a time to discuss whether all of these are real or fads or whatever, but there are some doctors who do believe that tongue, lip, and buccal ties are overtreated. There are some types of doctors who will do the tongue and not the lip on a baby, and there aren't many who will do buccal ties. That's not saying that you shouldn't use that provider. It's just having that information because it gives a little bit of a hint into how much education and experience the provider has in treating tethered oral tissues in breastfeeding infants. Now, what I think is one of the most important questions is, do you have a network of international board certified lactation consultants, IBCLCs, and body workers such as physical therapists, chiropractors, occupational therapists, cranial sacral therapy providers, etc.? And I don't mean to leave anyone out, but do you have a network, speech language pathologists? Do you work with those types of providers in a referral network? And can you recommend specific providers for me to be sure that this is the procedure that my baby needs and to guide the recovery that my baby needs? Now, if the provider doesn't even understand what you're talking about, then this is not the place for you to bring your baby. Because those who are doing an excellent job with the frenotomy understand that this is not just about the procedure, right? So that's another topic for another day. But these are clues that those of us who are networking with each other, have education together, we work in networks. We're invested in knowing, we're invested in the education, and we understand that in order to have the best outcomes, we have to know that we're not the only one responsible for that outcome. Okay? So that's powerful. And most providers who are experienced in treating infants will have the right answers for you, I expect. Now, other questions to ask is, what's your experience with TOTS? How long have you been releasing them? How many procedures have you performed? And how many procedures have you performed with this tool, right? So maybe they used to use a scissor and now they're using a CO2 laser. How long have they had that laser? What are their outcomes? All of these are important to ask when trying to decide if you're going to trust this provider with your infant. Couple of just things to know so that you're prepared. Will parents be allowed in the room with the baby for the procedure? Some doctors, dentists let the parents in the room with precautions, and some don't. You may not want to be in the room, and some parents are okay with that. But I think it's important to know this ahead of time so that your nervous system is preparing for what is this procedure going to look like for us when we're there. Do you administer anything for pain during the procedure? And if not, why? And if yes, what is it? Because I think we should know everything our baby gets, right? And then another important fact or aspect to talk about is pain management after the procedure. Will my baby be in pain? Do you recommend whether it's pharmacological things such as Tylenol or Motrin, Advil, ibuprofen, or homeopathic remedies, or ice chips, or what do you recommend? And you always want to ask the provider doing that particular procedure what they recommend. And you want to have that ready ahead of time, right? And we'll talk more about that. Anyone out there on Instagram? I am, and I've been working hard at growing my Instagram account. Of course, it's called Tongue Tie Experts, and it's about to reach 10,000 followers. Hopefully, by the time you hear this, we'll be at 10,000, which has been a goal of mine. Just want to let you know, if you want to know how I did this without paid ads, without any advertising at all, or any sponsorships, all with organic, simple methods, you can come to my webinar called Simplifying Instagram, and it's going to be on Friday, June 17th. So if you're listening to this the week the episode comes out, I hope that you'll look for the link in my show notes, follow the link and sign up. It's going to be a fun time. We're going to be very interactive, and you'll learn all the ways that I reached my 10,000 followers on the Tongue Tie Experts Instagram account. Come follow us over there if you don't already. Hope to see you there. Going along with being prepared for what the day is going to be like, ask if there is a space for you to feed your baby after the procedure, whether that's for breastfeeding, chest feeding, or even bottle feeding. Is there a private space that you guys will be allowed to hang out in after the procedure, or will you have to leave right after? Very important, especially if you're traveling a long distance to see your particular doctor, which often happens when you're looking for someone expert in this field. I'd also want to know what exercises and stretches they recommend, and will they be demonstrated to you, what kind of education you'll be getting. We often are very nervous. I know I would be, and I do have the experience of my child having a surgery when she was 3 months old. My youngest had a cleft lip. She was born with a unilateral cleft lip, and at 3 months of age, she had to have surgery to fix that. And I was very nervous, and what helped me to know was what's going to happen afterwards. So you want to think about that. What's it going to be like after the procedure? Where am I going to be hanging out? How long will it take me to get out of your office? After I come out of your office, what will that night be like? What should I expect it to be? How do we get in touch with you if we have any questions or concerns? Some doctors will give you a phone number. Some will, call you themselves. You want to know what to expect in that way, and how uncomfortable you think the baby will be, and what you can do if certain things happen. So you want to have some anticipatory guidance, as we call it, about what it's going to be like that night, and what are possible complications, and how often do they see them. Now, the possible complications I'm going to just go through very briefly because it's important to know. Possible complications of frenotomy are theoretically bleeding, right? Because it's a very vascular area, meaning there's a lot of blood vessels in the mouth. So it's possible that there will be bleeding. It's rare to have bleeding more than a couple of drops with a laser or even a scissor in the right hands, right? So it's rare, but it can happen. So you want them to be honest with you and say that one of the possible complications is bleeding. Another possible complication, which is even more rare, and I've never seen them, all my years of experience, I've never seen it, but it's always possible that you can have infection, because anytime we interfere with the integrity of the tissue of the body, whenever you make a hole somewhere, whenever you cut something, there's always a risk of infection. Extremely rare. Another possible complication is that the tethered oral tissue, the tongue tie, the lip tie, reattaches, right? So that, again, it's pretty rare,
but it's the most common complication that I see. So these are things you want to hear from your provider, because it's letting you know that they understand what you're concerned about and they are ready with answers and reassurances and the facts that lets you know that they are expert in their field. And perhaps the most important question before you leave is, when should we follow up? Will we come back to your office? Should we follow up with the IBCLC? When would you like to see us again? And if not, how do we know that everything is progressing as it should? So you want to leave with confidence that you know what to do next and what to expect next. So those are the questions to ask a provider and how to select a provider for your baby's procedure. I'm going to shift gears and talk about how to actually prepare once you've selected the provider and you've made the appointment. What are we going to do to prepare ourselves so that we have the smoothest experience with the least trauma to ourselves, our family, and our baby? Before I talk about preparing for the day of the frenotomy, though, I have a little ask. If you're enjoying this podcast, please follow Tongue Tie Experts Podcast on your favorite podcast app, whether that be Apple Podcasts or Google Podcasts or Spotify. If you like it and follow it, and give us a rating, and if you have time, a review, that helps us and it helps other families and other providers to hear the information. It's hard. There's so many podcasts out there. It's hard to get the attention, and the best way for us to get the attention of other listeners who need to hear this message is by you recommending it. So thank you so much for listening, and thank you for liking us and following us and sharing it. And if you have time, a review. Thanks. So back to preparing for the day of the frenotomy. Although frenotomy, again, is a minor, quick procedure, it definitely can be stressful. And preparation is key to keeping your nerves calm and will give you a smoother experience, hopefully, right? I would always suggest to bring another adult with you. If you have a partner and your partner can come with you, that's great. If you're a single parent or your partner cannot attend, invite a family member or a friend, mother, sister, best friend, someone who is going to be supportive of you, right? Another adult being there is helpful for questions and answers during the consultation. It's another set of ears to remember instructions, because when you're very nervous, sometimes you think you're hearing things, but you don't always hear things, and I've been in situations, in medical situations, where I was in the same room with another adult, and when we went home and discussed it, because what they were hearing was traumatic for them, they completely blocked it out and had another view of what happened. So it's always important to have the experience of someone else listening and helping you to ask the right questions and get the answers you need and you deserve. Also, to give you emotional support, right? This is hard. It's always hard to hand your baby over to someone and say, give you permission to do this procedure, whatever that may be, on my infant, right? It's really hard. And I've been there, as I said, and I remember what that was like. If I was alone, I think it would have been much more traumatic for me, but I had support around me, and that was very helpful. Also, very practically minded. Having someone in the back seat with the infant for the ride home, especially if you're traveling far to the office, can be reassuring for all of you. So if you have somebody else who's driving and you could sit in the back seat with the baby or vice versa, that would be very practically helpful. Now, if possible, and I realize that this is not possible for everyone, but plan a restful staycation for at least 2 days after the procedure. And what do I mean by a staycation? I mean, if you can, take off from work, don't schedule social visits, do any shopping you'll need ahead of time, plan to be in for 2 days, plan to not be able to do anything else but take care of your baby for 2 days. Now, this may be a little bit overkill. This may be extreme. And it's not typical that there are 2 days where you can't do anything else. However, if you have that planned out and the worst case is everything goes smooth and you're ready anyway, right? And then again, if you're attempting breastfeeding, resting is never the wrong answer. So plan to do nothing else. Don't do it on a Friday and have the baby's, naming celebration or christening the next day. Not a good idea. Getting to the mommy in me, have simple, nutritious meals planned and or ready. This is a great way to have friends and family, if they're available, to help out. Say, would you mind cooking us dinner tomorrow night and bringing it over so that it's there when we get home, right? Because if you're upset and the baby's upset, you don't want to have to then worry about, now what are we going to eat, right? And you don't want to get hangry, right? You want to have good food ready for you. If possible, arrange for childcare for other children, or at least someone to help you care for them. I'm sensing this scenario of you get home from the procedure and the person that came with you has to work the night shift and is leaving you alone, and you have other kids. So see what you can do. At least think about what you can possibly do for your other kids, or if your other kids are old enough to have a conversation with and say, I'm going to need a little bit more support. We're going to be taking care of the baby a little extra tonight, depending on the age, obviously, of the kids. Very important, and something that we often don't think about until we are on the way home, is deciding on a pain relief method. Shop ahead of time and bring it with you. So if you're deciding to use mainstream medications like acetaminophen or ibuprofen, have those on hand. If you're deciding to use homeopathy, especially, some of the remedies may be a little bit harder to find, or you may have heard of a special blend to use and you have to mix that ahead of time. Do all that before you go, because the worst thing that can happen is you're driving home with a screaming baby and you're looking for, a drugstore or, a health food store to get what you need. Prepare ahead of time. Now, that being said, some kids are fine. Some kids need nothing, but you want to be prepared. I feel like I'm doing like the Boy Scout announcement here, right? Isn't that their motto? Be prepared. Okay. Now, more in preparation is, if you are a breastfeeding parent, have an alternate feeding method ready just in case. Now, ideally, you will discuss this with your lactation consultant, who will know what will be best for your particular situation. This may be a cup, a spoon, a syringe, or a bottle. If you are supplementing, bring whatever supplements you are supplementing with. If you are not currently supplementing, bring some express breast milk with you. This is especially important if you're traveling, right? If the office is around the corner from your house, have this ready at home. But if you're traveling, bring this with you. Also, if you're traveling a long distance, bring your breast pump with you, just in case. You want to have everything on hand just in case. If you are currently using a nipple shield, bring it with you. Do not be under the impression that everything is going to be unicorns and roses as soon as the procedure happens and your baby's going to be able to latch without the nipple shield. By all means, you can try it. However, you want to have everything that you usually use to feed your baby with you when you go for the procedure. What else? Let me just summarize, right? So what are you going to bring with you to the appointment? And I have this all written down. You can download a handout from the show notes. Or you can go, that's where it's going to be, in the show notes. Okay. The checklist of what to bring with you to the appointment: a partner or a friend, a list of questions for the provider, pain relief method, a breast pump if traveling long distance, a nipple shield if you use one, alternate feeding method, express breast milk or formula if that's what you're using, and water bottle and snacks for you in case it's a long distance, in case you're waiting a long time in the office. As you can see, I never want anybody to be hungry. So I hope that this was really helpful for you when thinking about, yes, my baby is going to have a frenotomy, but we want to make it the smoothest, easiest, most effective procedure that it can be, right? And if you want to learn more about the actual procedure of frenotomy, there are other podcast episodes on that topic. Just scroll back and we have a couple of different frenotomy providers, and we have the laser specialist, lots of information in past episodes for you. As a lactation consultant, it's my goal that this information will give you the confidence that you need to have a successful and smooth experience with the least trauma possible, and that you and your baby will have the outcomes that you desire. Thanks so much for listening.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.